Very good morning, everyone. So I'll be presenting our work on comparative study of 4-week versus alternative treatment duration for ocular cysticercosis. No financial disclosure. Well, ocular cysticercosis is one of the preventable cause of blindness. The mainstay of medical management is albendazole combined with the corticosteroids. When we had a literature review, we found that there are studies which have used 2-week, 4-week, and the 6-week regime. However, till date, there are no randomized controlled trial which have compared these different regimes for ocular cysticercosis. So the aim of our study was to compare the efficacy and safety of 4-week, 2-week, and 6-week treatment regimes. Our primary and secondary outcome measures were the following. Methods. So we did a randomized control trial study. After ethical approval, all patients underwent ophthalmological examination, MRI of the CT scan, and along with the B scan was done in all the patients. Baseline blood tests were done. We included all the naive cases who were clinico-radiologically confirmed cases of extraocular cysticercosis. However, we excluded the patients who had intracranial or the intraocular extension. The rest of the parameters are enlisted. So we did a single-blind randomization where 76 patients were assessed for eligibility, 16 declined to participate, and 60 patients were randomized to 3 groups, each having 20 patients. In Group A or 2-week regime, 1 patient was lost to follow-up and 19 were included in the analysis. In Group B, 3 patients discontinued and 17 were included. And in Group C, 4 patients discontinued and 16 were included in the analysis. Coming to the treatment regime, well, all the 3 groups have received albendazole in the dose of 15 mg per kg per day in 2 divided doses along with the prednisolone. For Group A, it was for 2 weeks. For Group B, it was tapered in 4 weeks. And for Group C, it was tapered in 6 weeks. Coming to the results, so we had 52 patients with a mean age of 21 years and a male preponderance. All cases were unilateral with a mean follow-up of 19 months. If we look at the baseline characteristic of all the patients, it was nearly comparable. However, in our series, the most common presentation was ptosis, followed by restriction of extraocular movements, diplopia, conjunctival congestion, and proptosis. The size of the cyst ranged from 5 to 15 millimeter, and 66% of the cysts were attached to the extraocular muscle, and in 34% of the cases, it was a subconjunctival cyst. The most common muscle involved in our series was superior rectus, followed by medial rectus, lateral rectus, and the inferior rectus. Coming to the primary outcome measures, so if you look at the decrease in the proptosis, it was significant in all the 3 groups. Improvement in palpebral aperture or decrease in ptosis was also significant in the 3 groups. However, the reduction in diplopia was significant in the Group C or the 6-weekly group. And the cyst reduction, it was significant in both Group B as well as the Group C groups. Coming to the secondary outcome measures, well, the side effects were mild and reversible. 2 patients in Group A had recurrence. Let's have a look on few of the cases. So this was a 7-year-old child who presented to us with a gradual progressive right eye ptosis since 1 month with a superior rectus involving cysticercosis. She underwent 2-week therapy, and at 27 months of follow-up, there is no residual lesion. This was a 15-year-old girl who presented to us with pain, swelling, and redness in the right eye since 2 weeks with a subconjunctival lesion with a congestion. And on MRI, there was a medial rectus involvement. She underwent 4-week regime, and at 13 months of follow-up, the subconjunctival cyst has completely resolved. However, you can see that there was a residual cyst which was still present in the medial rectus, but it was stable even at the 13 months of follow-up. This was 14-year-old male who had gradual progressive right eye ptosis with diplopia since 2 months, and he has restriction in the up gaze. There was superior rectus involvement on the MRI. He underwent 6-week therapy, and at 29 months of follow-up, there was mild residual ptosis. However, the movements have become almost normal, and there was a small fibrosis which was still present in superior rectus. If you look at different study, coming to the discussion part, so whether it was 2-week, 4-week, or 6-week, we found that the 6-week therapy had a better improvement in diplopia compared to the other groups. However, the residual proptosis, ptosis, and recurrence rate was nearly symmetrical in all the groups. So to conclude, 4-week regime is optimal for symptomatic relief. 6-week regime is recommended for better resolution of diplopia. However, tailoring of treatment to individual symptoms is essential. The limitation and future direction, well, the sample size definitely was a constraint in our study. We need a larger trial. However, future directives are intended to create a better and safer lifestyle with primary preventive measures. Thank you.
Thank you. Good slide.